This morning on The Real Story, as campaigns ramp up and the 2024 election looms, we're talking about a government of the people, for the people, how a Connecticut workshop is empowering local women to run and changing the conversation when it comes to steps forward for representation. But first, we're back with more answers when it comes to increased hospital acquisitions and mergers, insight on what those conversations look like, the reforms needed, and the financial challenges plaguing the industry. The Connecticut Hospital Association is joining us. Don't go anywhere. Good morning, and thanks for joining us on The Real Story. I'm Emma Wulfhorst. We've seen more and more of these hospital buyout plans, proposals, deals, as well as legal challenges. But with more hospitals struggling and seeking financial help, what does the process look like here in Connecticut, and how would advocates like to see it change? Well, joining me now to break it all down, Paul Kidwell, Senior Vice President of Policy for the Connecticut Hospital Association. Paul, thanks so much for being here.
Thanks for having me. Good to be back, and good morning.
Good morning. So before we get a little bit more into affiliations and mergers, we've spoken before about staffing struggles and rising costs that have really plagued hospitals, left them in the negative financially. From your perspective on the business side here, can you give people a picture of why we see these acquisitions becoming more necessary?
Sure. And so first, just on the sort of how hospitals in the state are doing.
Yeah.
We've talked about it in the past. The same pressures that are facing Connecticut's families related to expenses are those same that are being experienced by hospitals in the state as well. So when you think about energy costs and labor costs and just general costs of doing business, those costs have risen dramatically since 2020, and they've stayed significantly higher than historic levels. So continue to work through those added expenses, and at the same time, as we've also talked about, the revenue, the reimbursements that help support the care being delivered, especially in our state Medicaid program, aren't keeping pace with those expenses. So that certainly leaves those challenges remain. Thinking about those acquisitions and affiliations, fundamentally, it comes down to making sure that communities continue to be served with really extraordinary hospital and hospital care and care in the community. And so what we see across the state are those potential acquisitions, affiliations, where the end goal is to support care in the community. And the varying factors go into why those acquisitions happen. But again, end goal is, can we sustain and improve upon care being delivered in every community here in the state?
Right. And really quickly, you mentioned that Medicaid, Medicare reimbursement. We know there's been a call to try and raise that to be closer to the actual cost of service. Really quickly, where does that process stand? Have there been any updates there?
Sure. So I think the Department of Social Services, or the state agency that's responsible for our state Medicaid program, is really doing its due diligence, and they're studying the rates that Medicaid pays providers here in the state of Connecticut versus what that program looks like in other states. And so they came out with their first report some months ago, and we anticipate that at the end of this year, beginning of next, they will come out with a report that talks about the payments they provide to hospitals and federally qualified health centers. And at that point, I think we'll have a really good picture and understanding of what do we need to do comprehensively to address that issue in the state. And then the state legislature comes back in January, and we're really in a budget year. We have to create a new budget next year. And we're really hoping, and we'll be pressing for that conversation to happen during that legislative session, which starts early next year.
Gotcha. We know those are continuing conversations. So these, acquisitions and mergers Connecticut really calls this process, certificate of need. And you've said before that that process needs work, especially considering, as we've said, it's being utilized more now. There were some lofty goals and reforms proposed to overhaul the program, but that didn't happen this past legislative session. What are hospitals looking to change their certificate of need, and how do you think that this could get done?
Sure. So you're right. It didn't, we didn't make any significant changes to the certificate of need program this last legislative session. But that's not to say that we didn't make progress in highlighting the need for it. So I think there is universal agreement from the state agency, from the legislature, certainly from the hospitals, from the other healthcare provider community, that we do need to make improvements to the program. So that is actually a really beneficial outcome of all of this, is that we're all, marching in the same direction. We do need to make some changes. And so, the details will be in, well, where do we think we need to make the changes? Certainly, we think from our perspective that the process is taking too long. And it's the consequence of that is that we're not creating, I think, the dynamic healthcare infrastructure that we think is really important in the state. So we think there are reasonable improvements to be made. I think the state thinks that there are likely some reasonable improvements to be made. And what we do between now and when we start in January back in the legislative session is really the important work. And
Right.
I know that at the end of last session, the legislature indicated that they want to be involved in that process going forward. And so, we believe we'll get underway pretty soon here, and we'll do, the real hard work, the legwork in this time. And then hopefully we'll be ready to hit the ground running in January.
You said about, obviously making this process from your perspective easier and faster, but as you mentioned about the legislature wanting to be involved, they, as well as the governor's administration, spoke about making sure these deals have, quote, really good terms. So we're seeing with the proposed, Prospect Health and Yale merger, though that's having some problems of its own, and New Vance and Northwell too. What does it mean for these deals to have good terms?
Sure. Certainly transparency is important, and people need to understand what's being improved and what they can expect when the deals, are approved. We likely have some differing opinions about what the good terms are and are not. We certainly think that healthcare policy should be made, through the legislature. And certainly in communication with the Office of Health Strategy. We don't think that the certificate of need process is where statewide healthcare policies should be made in individual terms and conditions of deals. Certainly, we understand that when these acquisitions happen, all the parties are going to want to make sure that what is created is a really strong entity for the community. So those are the types of conversations that we need to have between now and January to see if we can't find agreement on how to make this process one which we think can really support really amazing healthcare delivery in the state.
Right. And we know Connecticut is known for a really good quality of health care, with the example of Yale's process potentially taking over Prospect Medical. After that cyber attack, we saw them ask the state for help, wanting incentives to take on these struggling hospitals. Do you think the state should be footing the bill and supporting those companies stepping up? Does the state need to be more involved here in getting some hospitals out of the hole?
Yeah, I think every deal is going to be slightly different, and it's certainly the state to determine whether support in any one area is necessary or not. When the hospitals enter those deals and negotiations and the terms change or the situation changes, the parties involved have to be nimble in addressing those, and there's all sorts of avenues to sort those out. And as we see with that deal, it's there's a process and it's ongoing. I will say, though, in the way to make hospitals stronger, the state does have a role in the Medicaid program, right? It's the state's program, and we think certainly that has a direct impact on the financial stability of hospitals across the state, and why we think we need to pay a lot of attention to that program going forward.
Right. When we do know the state has been starting conversations about the hospital, they do bankroll the public UConn Health Centers. Taxpayer money has been poured into that hospital to cover debt, but there are conversations, if the state can keep up or if they even should. There's a lot of private equity corporations and monopolies involved in healthcare systems nationwide now. But as we see, these mergers and hospital acquisitions grow and these hospitals needing help, we've talked about concerns, we talked about the process. What do you say to patients and residents who are looking at all this happening and wondering what it actually means for them and their quality and access to care?
Sure. Yeah, so again, as I noted earlier, fundamentally, we want to make sure that every community, every patient in Connecticut has access to really world-class care. And that's not just in the hospital, but in the community as well. So if you need an urgent care visit, you have a place to go. If you need a primary care physician, you can find one. If you need a specialist, you can find one. And if you need, a complicated surgical procedure, or if you have a disease that is rare, we want you to be able to get your care here in the state. And so as you see these acquisition affiliations happen, those are in the service of really creating a very strong healthcare delivery system in the state of Connecticut. We want you to be able to stay here in the state and feel extremely comfortable that you are getting really world-class care. And so we throw around all the acronyms, CON, Medicaid, all the different things. Fundamentally, our mission and goal is to create and support a really exceptional care delivery system so that patients can remain home, remain in their communities, and get care here.
Well, Paul, definitely a lot of conversations happening to follow ahead of next year's legislative session. Thank you so much for checking in. We really appreciate your time.
Appreciate it. Always good to talk to you.
And there's still more to come here, though, on The Real Story, from local involvement to diversity in the highest seats on Capitol Hill. A Connecticut initiative is trying to get more representation in politics. What are the barriers and what can make a difference? We're talking with the executive director of the campaign school next.